So I'm Cheryl Main. I'm currently a microbiologist, a medical microbiologist, and an infectious disease physician. I finished the program in '94. One of the things that did draw me to the program was the fact that it was problem-based learning. I was interested in that format, and that was the first time I'd done that type of learning. And I did thrive in that environment, which is the reason I stayed at McMaster to my med school there. And I can't imagine learning any other way. So I think that was the main thing. The other thing that interested me was the electives component, because at that point in my training I had no idea what I wanted to do when I finished. So it gave me some time to give me the opportunity to explore different things, and that was really useful for me at that point in my training. I did like the fact that the program was small and PBL, self-directed. Obviously the electives were fantastic for me. There were a lot of components I liked, but I think probably my favorite part was the fact that it was sort of a close group, sort of a small group, and I could tailor my learning to meet my own learning needs rather than, following a course outline. It teaches you how to learn on your own, which I think is a really important life skill. It also, I think, engages the learner a little bit more. I'm not a very good textbook, route memorization kind of learner, and even though I went on to do a specialty, medical microbiology, which is very textbook, knowing your genus, species, your biochemical reactions, I still applied the concepts of PBL to that to make it more interesting. My thesis project for me was a really big highlight of the program. I was very proud of the work that I did on the thesis and presenting it, and I think that was another one. But yeah, certainly being away and all the experiences that I had there were very important. The different learning experiences that I had, and I think really the fact that I went and I lived in Sweden. When I went for my 1-year term in Sweden, I showed up, my luggage wasn't there, I had nothing. I didn't know very many people there. I'd left my family, I'd left my now husband, my boyfriend at the time, for a year. It was dark all the time in Sweden, because January there's basically the sun comes up at about 9 and it goes down at about 3, so I was in the dark. And I thought, there's no way I'm going to survive this, and I did, and I did really well during my time there, and I think that it really inspired me to think that I could do whatever I wanted. The Sweden placement. So I was in Lund in Sweden with Astra. At the time it was Astra Draco. It's now Astra Pharma, I think. So all of my placements were there because I did my first placement there, and then they combined the second 2 placements and the thesis project, so I did a whole year there. It was fantastic. It was a very important learning opportunity for me, and I think if I hadn't gone to Sweden, I don't think I would have gone into medicine. Medicine wasn't even something I was considering. That time away gave me lots of different experiences, and gave me the opportunity to really reflect on what is it I wanted to do with my life, and I really don't think I would have gone into medicine if I hadn't, and that would have been a mistake for me. Well, I think because I did get those real life experiences, right? So the fact that, again, it's the Sweden thing, but also you're out, you're working, you're doing things that you wouldn't normally be doing as an undergraduate. My first year after I graduated, I did research, and I applied to both master's programs and medical school because I wasn't sure what I wanted to do, and then I got into med school. So I did the 3-year medical school at McMaster, and then I did my residency in internal medicine, and then my residency in infectious disease and microbiology, so it was a 6-year residency. I'm a medical microbiologist, so I'm responsible for the part of microbiology that goes on in the lab, and an infectious disease doctor. So I do about 10 to 12 weeks of infectious disease work in the hospital. I do an outpatient clinic a half-day a week, and I'm the program director for the medical microbiology residency program, so I'm responsible for those residents going through, preparing them for their exam. I would say think outside of what you normally, as I said, when I started the program, I said there's no way I could go to Europe. I thought that wasn't something that I could do, and I did it, and I hugely benefited from it. So I would say feel free to dream big and challenge yourself. Try new experiences. Take advantage of the fact that the program allows you to do that, because a lot of programs don't. And you never know where you're going to end up. When I was starting that program, if somebody said that I'd be where I am now, I would have laughed and said there's no way. I never would have dreamed that I'd be where I am, but I'm very happy that I am where I am. It does give you the confidence and the experience to go on to do other things. You come out further ahead than other students who haven't actually functioned outside of the university setting. So I think it does give you important skills, and it gives you an advantage over other students.